What is the connection between scoliosis and cerebral palsy? Scoliosis is a three-dimensional structural spinal condition that causes the spine to develop an unnatural spine curvature that also twists into the concavity of the curvature. Scoliosis is a progressive condition and it's in nature to worsen over time. Most cases of scoliosis involve idiopathic scoliosis, and idiopathic scoliosis is an unknown cause. 80% of all known cases of scoliosis are idiopathic. The remaining 20% have known causes. One type is neuromuscular scoliosis, another degenerative, and the last congenital scoliosis. Degenerative scoliosis is caused by age-related spinal degeneration that typically occurs later on in life, somewhere 40, 50, 60 years of age. Congenital scoliosis is developed by a malformed spinal vertebra that develops in utero, and patients are born with congenital scoliosis. Neuromuscular scoliosis is caused by the presence of a larger neuromuscular condition, such as spina bifida, neuromuscular dystrophy, and cerebral palsy. Now, cerebral palsy is a group of neuromuscular conditions that can disrupt the nerve, motor, and cognitive function. Cerebral palsy is the most common cause of motor and neurological dysfunction in children, and this appears very early in childhood. Cerebral palsy can range from very mild presentation to very, very severe presentations, and normally involves increased or decreased muscle tone. It causes muscle changes that can affect gait, joint function, and movement. And a lot of times we see this kind of spasticity or stiffness in certain joints. It also can lead to significant motor skill problems. Now, scoliosis caused by cerebral palsy will fall under the neuromuscular scoliosis category. And this type can be very severe, and it can be also considered an atypical type of presentation because sometimes these curves in the thoracic spine can bend to the left as opposed to the right. And typically when we see a atypical scoliosis presentation, there's a greater chance that there's a neuromuscular involvement. Cerebral palsy affects not only muscle health, but it can affect neurological function, and the ability of the spine surrounding muscles to support and stabilize it can be disrupted, and this can cause the development of a scoliotic curvature. Neuromuscular scoliosis cases are some of the most challenging to treat because they're caused by this larger neuromuscular condition like cerebral palsy. Common symptoms with scoliosis in cerebral palsy patients are very similar to what we see in patients without cerebral palsy, but they can include other things like a loss of sitting balance, a lot of balance issues. We can see an uneven waistline, we see uneven hips and uneven shoulders. We can see pelvic obliquity, we can see development of a rib cage arch, a lot of these postural things. Good news is that we don't think patients that with cerebral palsy and scoliosis experience a lot of pain from their scoliosis, just like their non-cerebral palsy counterparts that have scoliosis as well. Now, when we look at treating a patient with scoliosis and cerebral palsy, like I mentioned, this can be sometimes complex to treat because we're dealing with two things. We're dealing with the curvature and the cerebral palsy. Now, we consider the scoliosis to be a secondary condition. However, once scoliosis starts, the problem here is that the scoliosis becomes structural, and the structural scoliosis must be treated as a structural problem, meaning that if we were to correct the cerebral palsy, which is not possible, let's say we could completely correct it, doesn't mean the spine will completely straighten because the curve now, the person has grown with the curvature and the curve has become structural within the person's spine. So therefore, patients with cerebral palsy, we still treat the curvature like a curvature, and we address it using physical therapy, chiropractic care, corrective bracing, and exercises, and we do as much of these things as possible based upon what the patient can tolerate and do. I've taken care of many patients with cerebral palsy with great success, and the idea is reducing the size of curvature and trying to halt and stabilize progression and improving the body and shape of the torso. Now, scoliosis caused by cerebral palsy, like I mentioned, can be called an atypical scoliosis, meaning one of the features is a left bending thoracic curvature. Typical scoliosis cases typically bend away from the spine or from the heart, which is a right bending curvature. Atypical cases across all conditions are more complex to treat, but the best time to treat scoliosis is always now, because the sooner you reduce a curvature, the sooner you prevent it from getting worse, the more likely you're going to have a positive result with conservative treatment. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.